The most important treatment is prevention, because we can prevent or slow down dementia from taking grip on us. The way we do that is by looking at all the risk factors, and that is the start of that is blood pressure control. So we need tight control of blood pressure, and that is essential for all diseases, whether that's in the brain, which is dementia, whether it's in the heart or in the vascular tree. It is very, very important to have a very good control of blood pressure. Then comes diabetes, good control of diabetes or prevention of diabetes, tight control of cholesterol, and of course diet. So eating monosaturated fat, if you eat peanuts and other nuts, green leafy vegetables, and having fruits, and having a well-balanced diet, cutting out the protein and the fat. That is the most essential way to treat dementia in the early stages, and I would recommend it to you. Then, of course, there are non-pharmacological treatment options such as lavender. So I recommend lavender shampoo, lavender oil, and lavender soap. After that comes melissa, and also if you think about other things which are important, is to drink lots of coffee. So it's the caffeine that is converted from acetylcholine to dopamine. So I recommend 2 cups of coffee every day. And exercise, lots of exercise. Exercise is essential because when you exercise, you actually have blood flowing through not only in the body, but also in the brain. And therefore it is essential to have little walks, 40 minutes a day, every day. Aducanumab has been a game changer because for the first time we have seen that it works on the amyloid protein. Now, the amyloid protein plaques we know occur in the brain, and they cause a traffic jam basically, and therefore the messages are garbled and can't be properly understood. We now have within our reach a drug that can reverse the amyloid plaque formation. And certainly the PET scanning that has been done in the Biogen study shows that the plaque shows regression, and therefore there is clinical improvement. And when we do have aducanumab, the recommendation is that we have regular PET scanning so that we can see what happens to the plaque regression. So aducanumab has just been launched and approved by the FDA in June this year. And the Americans are starting to use it, and we hopefully will get this drug sometime next year. And we are waiting for the initial studies. I'm hoping that it will be approved soon, so that after 23 years, we finally will have an effective drug such as aducanumab, where Fortune had a cover story, and there have been billions of pounds invested. And it looks like after lots of false dawn, we are finally beginning to see a drug that is effective. The way to think about dementia is, as I explained to all my patients, that it's like having a little leak in the engine of your car. So although I can give you petrol from outside, I can't fix the leak, but I can make you go from A to B. So, but the quality of oil I will give your car is not as good as the oil you've had. Although the car will run, it will stutter a little bit and can sometimes stop, but again run. So conventionally, we use acetylcholine inhibitors, and certainly the earliest one that was launched in 2000 is still donepezil or Aricept, the most popular drug. There's a study called the AD study that shows that you can halt things for up to 3 years. So there are 3 categories of people. There are people 1/3, the top 1/3 where there's improvement, second 1/3 where the disease can be stabilized, and the other 1/3, unfortunately, it doesn't work. The second drug is called galantamine, and that's got nicotinic acid receptor activity. Galantamine is effective for mixed dementia. So in the past, we've had no treatment for mixed dementia, and therefore galantamine can be used 8 milligrams, 16 milligrams, and 24 milligram doses. The third drug is rivastigmine. Now, rivastigmine is an interesting way of delivering the drug. It can be given as a patch. So people who can't swallow They can take it as a patch because it goes directly into the bloodstream, and rivastigmine is effective for this sort of for people who have swallowing problems, and also effective for Parkinson's disease dementia. The other second line drugs, which are very popular, are the NMDA receptor antagonists. So Memantine is the #1 drug used for moderate to severe dementia. Memantine is a useful drug for people who are starting to get visual symptoms and early memory behavior problems. It can be used alongside with the anticholinesterase inhibitors, and there's some recommendation studies from Belgium and Germany that dual therapy is effective. So we often use it in certain people where the dementia is starting to progress. Now, in the past, we've had no treatment for vascular dementia apart from control of the risk factors. And we say tight control of blood pressure. But the new NICE guidelines in 2021 and a recent study is showing that if you do have vascular dementia, then you should try straight away donepezil 10 milligrams daily. So this is a new study, and it's interesting that we should try it. I suppose this has come more in desperation because we've had no effective therapy for vascular dementia. But I think the acetylcholine inhibitors and the NMDA receptors such as Memantine can hold the line and buy you time until these new drugs come into the forefront. So the newer drugs, we found that there are two real pathways. One is the amyloid pathway, which is the Aducanumab. There's another pathway, which is the tau pathway. The tau proteins, when they accumulate, that also causes severe problems. And we have now a drug which is going to be launched in 2 years, LMTM it's called, and they're just sorting out the dosage. The advantage of this drug is it's a tablet. The Aducanumab or Biogen is going to be a monthly injection, and therefore you probably need to come to hospital, a day hospital, once a month, which is okay, but tablets are better because tablets are easier to deliver and easier to take. So one is going to be against the amyloid protein, and the other one is going to be against the tau protein. Together, the two of them, we now have two very good drugs. Rather than rather than sort of trying to pour oil into the leaky tank in your car, I hope that in the future I can fix that leak, which is what you want. So the most effective way still to prevent dementia is to be aware that early treatment is the way forward, and there is no need to wait until you reach a tipping point. So although you should exercise, you should take the right diet, you should keep your brain active, and there's very good evidence that if you don't use it, you lose it. So it's very important to keep on reading, very important to do your crosswords, very important to do your jigsaws, very important to go on your walks, carry on reading, carry on socializing, make sure that you have a job every day to do, whether it's ironing shirts or going to the shop. Make sure you do all that so that your brain is active. Make sure that you have good communication with everybody, because the tendency is that with dementia, you lose your motivation, and the tendency is to sit at home quietly, but you mustn't allow that. And therefore, once you've done all that, if you think that your brain, because originally when it starts in the early stages, you have good and bad days. So when you have more good days than bad days, you think that, oh, it's all going to pass. But if it's gone on for more than 6 months, and you still feel that you have lapses in your memory, where you're finding it difficult to remember names, difficult to remember faces, you're not sure if you've paid the newspaper agent twice, or you're finding it hard to socialize, you've become quieter, your personality has changed, where you listen more and talk less, your social circle is shrinking. These are the telltale signs that you should come and see a specialist. And early treatment is much better than late treatment, because you can get that at least 18 months to 2 years of a good quality of life, where we can hold the line until these two new drugs can come out. And I think it's important to do not ignore these signs, do not ignore dementia, because it's no longer a taboo. It's something that we get because of us living longer. It's perfectly common, and I'm very pleased that a lot of people are now saying they've got dementia rather than saying that it's a taboo. We shouldn't be talking about dementia because a lot of people say, "Oh, it's just brain failure. It's my age." Remember one thing: that dementia is nothing to do with aging, because aging is not a disease. So therefore, if you have this condition, you should be treated early. And certainly, there is a cousin of dementia called MCI, or minimal cognitive impairment, which means that for your age, sex, and education, you're two standard deviations below that. And that doesn't mean dementia. That means that you're still well groomed. That means you're still able to look after yourself. That means you're still able to cook and go out, and you're still able to carry on with a pretty normal life. So it's important that you come to a specialist to see, have you got minimal cognitive impairment or have you got early dementia? And the earlier you come, the better. Dementia can be eminently treated by non-pharmacological methods and pharmacological methods. And I think that the important thing to remember is that it's not a death sentence. Dementia is not as bad as a lot of diseases. In fact, I've got many people with dementia who are still here after 30 years of diagnosis. And therefore, it progresses in different ways in different people. We don't use our brain, we only use 20% of our brain. And we now know that the brain has neuroplasticity, where the brain can remember things. And there are 8 domains of the brain, and we certainly don't use all our domains. So I've had many people who, despite having dementia, they're still writing, they're still publishing, they're still doing concerts, they're still going to work, and they're leading a normal life. And if you saw them in the street, you would never ever think they've got dementia, because they look normal, they act normal, and it's because of good treatment, really, and early treatment. But obviously the problem is people come late, and therefore obviously it's a mountain to climb at that stage. But it's certainly not a death sentence, and they should see a specialist to get early treatment, early intervention, early diagnosis. And I think the earlier you come, the quality of life will be better.